had a few teething problems at the start of the NHS 111 contracts that we took on for Northamptonshire and Nottinghamshire. Taking on the two new contracts as part of a more national service presented a few challenges. We have had a difficult time in the last few weeks and not achieved all of the quality standards that were required, but now we are. After about 6 weeks we managed to turn things around by intensive support and further training and recruitment, and now we have a very safe, efficient service, and we're providing a service that meets all of the national quality standards now, so we're very, very pleased.
So we're all aware that this winter we've had real problems with urgent and emergency care. The system we have is unsustainable and things have to change. So what we've done is bring together a group of doctors and nurses and patient representatives who've lived and breathed this problem, and they've come up with their ideas and they've looked at the evidence that may help us change the system. But what's going to be different is we're now asking you to help with that, to contribute, to tell us what you think, to put in your ideas so that we can redesign a system that is really sustainable and meets patients' needs.
Since the advent of the CCGs, we've had very, very close relationships, both with the managers and the doctors in the hospital. And we can have sensible discussions. So we have weekly meetings, either face-to-face or on the telephone, to predict where problems are going to be and who's going to step up to the mark and what we're going to do about them. So we're hoping to preempt the problems. And that's shown itself, because where previously we were failing to meet the national target of 95% of patients seen within 4 hours, we've just met the 95% target this quarter for the first quarter of the CCG. And we're really proud of that, and the Trust should be really proud as well. The Director of Performance has got my phone number, I've got his, and if there's a problem either way, we just pick up the phone or email each other, and we'll try to sort out whatever the problem is as rapidly as we can.
One of the major scandals in the NHS, I think, is that if you are unlucky enough to fall ill and you need something done, it's been almost impossible to find out who does what. You know, what volumes of surgery are done by individual practitioners, what their outcomes are, and that's all changed now with this announcement. This is a major event in the history of the NHS. We know from cardiac surgery over the last 10 years that if you collect this data, analyse it, feed it back to clinical teams and publish it, you get massive improvements in quality. So the mortality rates in cardiac surgery now are a third of what they were 10 years ago. And now that methodology is being applied to these other specialties. That has to be good for patients. Not everybody in the profession has welcomed this initiative with open arms, but in my view it is a privilege to be working as a doctor and as a surgeon, and with that sort of privilege there are some responsibilities, and I think one of those responsibilities is to measure what you do and to demonstrate openly to the public that you're doing that to a satisfactory level. I think if you're not prepared to do that, you shouldn't be doing it at all.
Patients being able to access surgical outcome data is important. It means that they can make an informed decision about which consultant they go and see at which hospital, and that can only be a good thing.
The NHS is 65 years old. It's facing huge challenges and pressures for the future. The expectations of our patients, the demands on the service, the development of medical technology, and the financial circumstances that we find ourselves on. The call for action is to call for people to come together to think about what the NHS of the future might look like, to make their contribution, whether they are people who work in the service, who use the service, or members of the public. How can we all work together to get a compelling vision for the NHS for the next 65 years?